Let's begin with another topic in cardiovascular system, guys. It's a very important disorder called as hypertension. So the drugs we'll be discussing are called as antihypertensive drugs used against hypertension. And to begin with, let us basically see what is hypertension. Hypertension is nothing but it is an increased blood pressure. Right, based upon how much the blood pressure is increased, I can classify hypertension into mild and moderate hypertension and severe hypertension. So mild to moderate hypertension is blood pressure more than 130 by 80 millimeters of mercury. This is called as mild to moderate hypertension. Severe hypertension, guys. Severe hypertension can be broadly subclassified into hypertensive emergency and hypertensive urgency. Now, how do I differentiate between emergency and urgency? There is something called as end organ damage. There is something called as end organ damage, and end organ damage, it can be seen in the form of, see, what do you mean by end organ? All the blood vessels, arteries, they supply your organs like heart, liver, kidney, retina. If due to high blood pressure there is damage to these organs, it is called as end organ damage, which can be in the form of, for example, hypertension causing retinopathy or encephalopathy or congestive heart failure or pulmonary edema. So if there is some damage to some organ, then I'll call it end organ damage. Now remember, guys, if end organ damage is present, to make a diagnosis of emergency, there must be end organ damage and the blood pressure is usually high blood pressure. Right, so obviously without high blood pressure, damage will not be seen. But I cannot quantify the blood pressure here because the most important factor to make a diagnosis of emergency is not high blood pressure but end organ damage. So at whatever high blood pressure, if there is end organ damage, automatically it becomes what? Emergency. But to make a diagnosis of urgency, this end organ damage must be absent. There should not be any end organ damage. And obviously here there is high blood pressure. I must quantify how much it is high. The blood pressure should be more than equal to 220 by 125 millimeters of mercury. Right, so this is when I call it as a case of urgency. So first of all, as a nurse, you should have a basic idea of what is an emergency, urgency, which becomes severe hypertension, what is mild to moderate hypertension. Now, so three types of hypertension or disorders associated with hypertension, which we are going to discuss. Now, coming to the drugs here, number one, drugs used in treatment of mild to moderate hypertension. Right, so these are nothing but these are antihypertensive drugs. Right, antihypertensive drugs. See, drugs used in mild to moderate hypertension can be broadly subclassified into first line drugs and second line drugs, which means what? To begin with, I'll always prefer a drug from first line category. Right, if they're not effective enough, then I can move on to a second line drug. First line drug, there are only three drugs or three classes of drugs: ACE inhibitors, ARBs, calcium channel blockers, and thiazides, which are diuretics, isn't it? So these are three classes of drugs in first line. Now here in this topic, we'll not discuss in detail about these drugs. because all antihypertensive drugs which are vasodilators. So there is a topic I have discussed in cardiovascular system called as vasodilators. You will find in detail about these drugs. Thiazides, there is a topic called as diuretics where you will find the details of these drugs. So you will not repeat the same thing time and again. Whatever remaining drugs are second line. Remaining means which are these drugs? These are drugs like alpha blockers, beta blockers, alpha 2 agonists like clonidine, spironolactone, direct renin inhibitor, etc. So whatever drugs are remaining, they are second line drugs. And these are the drugs which are used for treatment of hypertension. Now, how do I use a drug, particular drug for treatment of hypertension? How do I choose one drug? Now, remember here, a drug that is preferred in mild to moderate hypertension, it depends upon age. So, whenever a patient of mild to moderate hypertension is treated, what we see is the patient young or is the patient old? So, with respect to hypertension, which age is considered as old, which age is considered as young? So, guys, if the patient is less than 55 years, it is considered young. If it is more than equal to 55 years, it is considered old. Now, why is it that there is a difference in treatment of hypertension in young and old patients? The very basic concept lies in the level of renin. Now remember, in young patients, renin is high. In old patients, renin is low. In other words, in old age, hypertension is called as hyporeninemic hypertension. Young, this is called as hypereninemic hypertension, right? Why it happens as such? Because see, in old patients, just imagine a person who never had hypertension in his entire lifetime. He reaches to 70 years of age, 70, all of a sudden he develops hypertension. What is the cause? The cause is in the blood vessels. They have undergone atherosclerosis, calcification, and they are stiff. They cannot dilate. And once they cannot dilate, right, what happens is they would ask the RAS system to cool off, to calm down. Please do not make renin and angiotensin, and please do not contract me because as it is, I'm not able to dilate. So what happens? RAS calms down and there is decreased renin. But imagine a patient 30 years, only 30, he develops hypertension. What is the cause? The cause is vasoconstriction. Who is causing vasoconstriction? RAS is overactivated, produces a lot of renin, that produces angiotensin, produces vasoconstriction. Now, if I know this, the treatment is simple. If it is hypereninemic hypertension, which drugs I'm going to use? Drugs which will tame the RAS or block the RAS system. And these are ACE inhibitors, ARBs. Now, from second line, you know that beta blockers can also decrease renin because beta blockers will block beta 1 in the JG cells of kidney and decrease synthesis of renin. So, ACE inhibitors, beta blockers can be used. Whereas, in old age, the remaining two hypertension drugs in first line, calcium channel blockers and thiazides are used. Thiazides, which are the diuretics, right? And remember here, the drug of choice in young age is ACE inhibitor ARB. The drug of choice in old age, it is calcium channel blocker. How to remember this is very simple. Alphabetically, A, B, C, D. So in young age, I prefer to start with A, and A, B are the drugs used in young age. Old age, C, D. Preferred drug is C. As simple as that, guys. You can master mild to moderate hypertension by 4 alphabets A, B, C, D. Right. So this is your treatment of hypertension by using these drugs. Now coming to hypertensive emergency at one side and hypertensive urgency. Now I've already told you what is emergency, what is urgency. Now the difference is in urgency, I use oral drugs. Oral drugs like oral clonidine, captopril, and nifedipine. Clonidine is the drug of choice. So the clue is an oral drug we are supposed to use in urgency, whereas in emergency we'll be using an intravenous drug, and the drugs used in hypertensive emergency you can remember as Helen Dance. Right, who is Helen? I guess all of you might be knowing about it. If you don't know, right, ask your father, he will tell you who is Helen, right? So she was the Katrina Kaif of your father's time. So Helen Dance, and she was a very popular dancer in Bollywood. So the drugs you can remember as hydralazine, enalaprilat, labetalol. Lasix is furosemide, guys. Lasix is furosemide, esmolol, nitroglycerin, and nitroprusside and dihydropyridines like clevidipine and nicardipine. And the drug of choice overall in hypertensive emergency, the drug of choice is intravenous nicardipine. But if they ask you what is the drug of choice in pregnancy for hypertensive emergency, your answer will be this, right? Finally, guys, I'll talk about something called as if there is a patient of mild to moderate hypertension with comorbidities. So there is some other disease. For example, there is a patient of hypertension with diabetes mellitus or chronic kidney disease or nephrotic syndrome or scleroderma. In this case, my drug of choice is ACE inhibitor, ARBs, which I've already told in the section of vasodilators. The most importantly asked MCQ is this one. Hypertension with diabetes mellitus, what is the drug of choice, right? Now, why this is being used here? Because ACE inhibitors, ARBs, they decrease what? Proteinuria, and they are nephroprotective. That is why they are preferred here. If there is a patient of hypertension with, let us say, migraine, hypertension with anxiety, hypertension with tremor, any tremor disorder like essential tremor, hypertension with hyperthyroidism, angina. In this case, my drug of choice, they become beta blocker, because beta blocker are used against all these disorders, plus it would be effective in hypertension. If it is a case of hypertension along with BPH, benign prostate hyperplasia, my drug of choice are alpha blockers like prazosin. If it is a case of hypertension with osteoporosis, my drug of choice are thiazides. If it is a case of hypertension with Raynaud's disease, my drug of choice are calcium channel blockers, because calcium channel blockers are also drug of choice for Raynaud's disease. So hypertension with Raynaud's, I go for CCBs or calcium channel blockers. So guys, this is how I treat hypertension that is associated with comorbidities. So in this topic, briefly, we discussed how to put things in perspective with respect to use of drugs for treatment of hypertension. About the antihypertensives, I've discussed in detail in different sections, right? Here we have just put them together, and beautifully we have seen how to treat different types of hypertension.